Hi, you guys. Welcome back for our daily practice questions. It is day 106, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 16-year-old male presents to the urgent care with sudden onset, severe right testicular pain that started 2 hours ago while he was watching TV. He feels nauseated and vomited once. No history of trauma. On exam, the right testicle is high riding with horizontal lie and significant tenderness. Which of the following is the most likely diagnosis? Is it A, epididymitis, B, incarcerated inguinal hernia, C, testicular torsion, or D, hydrocele? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which of the following is the most likely diagnosis? And y'all know what I always tell you, if they're looking for a diagnosis, you need to run it back and look at those assessment findings. How are they presenting? What are the signs and symptoms? What is noted on exam? What's that chief complaint, right? So here we have a 16-year-old male. He comes in to the urgent care office with sudden onset severe right-sided testicular pain that he says started 2 hours ago while he was just simply watching TV. He does feel nauseated, has vomited, no trauma, and on exam, the right testicle is high riding, right? Y'all, this is classic presentation for C, testicular torsion. One of those things also is that sudden severe pain, but testicular torsion, and we'll talk about it a little bit more after question number two. All right, question two. A 14-year-old male presents with left testicular pain for 6 hours. On exam, the scrotum is swollen and tender. Elevation of the testicle worsens the pain. The cremastic reflex is absent on the affected side. Which of the following is the most likely diagnosis based on these findings? Is it A, epididymitis, B, testicular torsion, C, varicose, or D, testicular cancer? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, which of the following is the most likely diagnosis based on these findings? So again, we need to run it back and look at those assessment findings, right? Because it's asking for a diagnosis. So we have a 14-year-old male who comes in with less testicular pain for 6 hours. On exam, the scrotum is swollen and tender, and elevation of the testicles worsens the pain. Y'all, this right here is your key. Think about your Pren sign. With Pren sign, we elevate the scrotum, right? If there is relief of pain, that's a positive finding, right? If there's no relief or the pain worsens, that's a negative finding for a Pren sign, right? So Brittany's Brilliance, I always say, think of the P's. For epididymitis, epididymitis has a P in it, testicular torsion does not, right? So a positive Prens, P, positive Prens, you think epididymitis. Testicular torsion has an N in it, epididymitis does not. So when the Pren sign is negative with an N, think testicular torsion. So here it's negative because we elevated the testicles and the pain worsened. So best answer is B, testicular torsion. Positive Pren sign, epididymitis. Negative Pren sign, testicular torsion. All right, and lastly, question number 3. A 17-year-old male is diagnosed with testicular torsion in the emergency department based on clinical findings and a color Doppler ultrasound. It has been 4 hours since symptom onset. What is the most appropriate next step in management? Is it A, prescribe antibiotics and schedule outpatient follow-up? B, immediate emergency referral for surgical intervention? C, bed rest ice NSAIDs for pain control? Or D, manual detorsion in clinic with delayed surgical follow-up? Take a moment to tell me what you got, y'all. All right, so stem of the question, what is the most appropriate next step in management? Y'all, I tell you, even though it's worded like this simply means treatment, right? So how are we treating? So here we have a 17-year-old, and you know what I tell you, if we're looking for a treatment, we got to determine if they've given us a diagnosis, right? And they have. It says testicular torsion. The patient is in the ER, and testicular torsion has been confirmed. It's been 4 hours already since the symptom onset. They're asking, what would you do next? Testicular torsion is an emergency, right? So B is your best answer. We want to do an immediate referral for surgical intervention because think about what testicular torsion is. Testicular torsion is when there is twisting of the spermatic cord. That's why it's so painful. The blood flow is being reduced, so you need to have a surgical repair immediately to prevent necrosis, all right? All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, custom packages of plans, or question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.